Welcome to this series of micro-learning webinars on HIV, COVID and me. In this webinar, we will review COVID-19 oral antivirals and important drug interactions. These are the learning objectives for the activity. Upon successful completion, you will be able to list the available COVID-19 oral antivirals, explain how to take COVID-19 oral antivirals, describe important drug interactions with oral antivirals, and explain why people living with HIV can take the oral antivirals. Here is an overview of the presentation where we will examine COVID-19 oral antivirals, what they are, how to take them, which drugs interact with them, and how people living with HIV can take them. In December 2021, the FDA granted emergency use authorization for 2 different drugs to treat individuals with mild to moderate COVID-19 infection who are at risk for developing severe disease. This includes older adults and people with medical conditions such as heart and lung disease, diabetes, or an abnormal immune system such as some people living with HIV. First of all, let's review what severe COVID-19 disease is. Symptoms include trouble breathing, persistent pain and pressure in the chest, mental confusion, inability to wake or stay awake, and pale, grey or blue-coloured lips and nails, depending on the skin tone. Severe COVID-19 disease can land you in the hospital, and COVID-19 antivirals can reduce the chance of severe disease and hospitalization. There are 2 oral antivirals available. Both are taken by mouth at home. The drugs are Paxlovid and Lagevrio. In clinical trials, Paxlovid cut hospitalizations and deaths by 89%, and Lagevrio cut hospitalizations and deaths by about 50%. Paxlovid is a combination medication containing 2 drugs. Each pack of Paxlovid contains 2 separate, different-colored tablets. Paxlovid is a tablet taken by mouth twice a day for 5 days. The Infectious Diseases Society of America has made the following recommendation. In patients with mild to moderate COVID-19 at high risk for progression to severe disease, the IDSA guideline panel suggests Paxlovid be initiated within 5 days of symptom onset. Take Paxlovid exactly as your healthcare provider tells you to. Take 3 tablets of Paxlovid every 12 hours, for example, 8 a.m. and 8 p.m. Take Paxlovid for 5 days. It is important that you complete the full 5-day course of Paxlovid. Do not stop taking it before you complete the full course, even if you feel better. Take Paxlovid with or without food. You should also stay in isolation for as long as your healthcare provider tells you to. What about different drug interactions with Paxlovid? While Paxlovid is effective against the virus that causes COVID-19, it can interact with some commonly used medications causing side effects. It is very important to tell your healthcare provider about all the medicines you are taking, because blood tests or a change in the dose of the other medicines may be necessary while you are taking Paxlovid. This includes medicines that you get on prescription, but also medicines that you buy over the counter, such as supplements, vitamins, and herbs. Your healthcare provider can tell you if it is safe to take Paxlovid with other medicines. Also, before taking Paxlovid, tell your healthcare provider if you have any allergies, have liver or kidney problems, are pregnant or planning to become pregnant, are breastfeeding, or have any severe illness. In some situations, it may be possible to interrupt some medicines while you take Paxlovid. For example, Paxlovid interacts with the cholesterol-lowering medication Lipitor, but that's less challenging for patients to overcome. If you stop taking your Lipitor for 5 days, nothing bad is going to happen. But it is very important to say that antiretrovirals taken for HIV should never be interrupted. According to the CDC and FDA, people with HIV may be at higher risk for severe outcomes from COVID-19. Due to this increased risk, people with HIV may be considered for treatment with Paxlovid. Paxlovid may be administered with HIV antivirals, and people with HIV should continue to take their HIV treatment without interruption during Paxlovid therapy. Lagevrio is an antiviral medication that stops certain viruses from reproducing. It is used to treat the virus that causes COVID-19. Important to note here that Lagevrio is not recommended for use in pregnancy. The Infectious Diseases Society of America has made the following recommendation. in patients 18 years or older with mild to moderate COVID-19, at high risk for progression to severe disease, who have no other treatment options, the IDSA guideline panel suggests Lagevrio be initiated within 5 days of symptom onset. Other options include Paxlovid. Take Lagevrio exactly as your healthcare provider advises. Take 4 capsules every 12 hours, for example, 8 a.m. and 8 p.m. Take Lagevrio for 5 days. It is important to complete the full 5 days and do not stop taking Lagevrio just because you feel better. You can take Lagevrio with or without food. You should stay in isolation for as long as your healthcare provider advises. No drug interactions have been identified based on the limited data that we have available for Lagevrio. But important to note that no specific drug interaction trials with Lagevrio have been conducted. According to the National Institutes of Health, Lagevrio may be taken with HIV antivirals, but talk to your healthcare provider about all the medicines you take before you take an oral antiviral for COVID-19. COVID-19 Rebound is a new positive COVID-19 test with or without COVID symptoms after completing a 5-day course of oral antivirals and testing negative for COVID-19. COVID-19 Rebound has occurred with both Paxlovid and Lagevrio therapy. People with COVID-19 or suspected COVID-19 rebound should talk to their doctor straight away and isolate themselves from other people until they test negative. So let's summarize what we have just learned. Some people with HIV may be at increased risk for serious COVID-19 disease. That risk can be reduced by oral antivirals, which do not interact with antiretrovirals taken for HIV. Oral antivirals may interact with other drugs. Oral antivirals do not interact with HIV medicines. The information in this presentation comes from the following resources. You may wish to visit these websites to get more information. Thank you.